I love workout clothes. I wear them all.
It's called piece roll. I told her to keep her line. I wanted her to keep doing her line. Okay. See how she's kind of sinking a little bit through here? I'm going to put a little, anybody have a towel about a little bigger than this? I need like double the thickness of this.
So this is not good when I'm sleeping?
When you're sinking in like that? No, you want to lift those ribs up.
Those are called hips.
Can you use this?
No.
No.
Yeah. That's good. We need 2 of those.
That's probably why I'm having back pains right here. You think? In the back?
Yeah, your kidney, your ribs probably poking into your kidney.
I'm having really bad.
Okay, so we're going to have you sit up for a second, and then I'm going to have you lay right where you want to lift her is from about, if you had to like line up nipple level, you want to lift from here to here and this portion of the ribs upwards. So lay down on that. Ah, yes.
So that's good. My
Look,
head is...
see it opens it all up there? So that's good for when we're going to do obliques. That's good when you want to do latissimus stretches. It's good when you want to work serratus, so you're not dropping in and down. So if you see a heavy dip, it's usually that's the way people sleep, you know?
Because my head is now going like this. It feels dippy. Is that... Yeah, I need another like this. Because when your head is down like that, that can make you snore, right?
Yeah.
That's what I thought.
Try out, see if your head and ear can fall over. What do you feel?
It feels great.
It does?
I know I was probably look weird.
No, but it feels good? Okay.
Yeah.
So you can just scoop it up under and let the head kind of come this way, and it's supported at the ear. It's a great little lift. You don't need it. Okay, serratus. Serratus goes ribs 1. So to get to rib 1, we got to move her arm, right? So it's going to rest over her head, just relaxing over her head. So we got rib 1. We know the scalene's attached to rib 1. Then we have rib 2, 3, 4, 5, 6, 7, 8. 8 ribs. All the costal attachments. All of these attach onto ribs 1 through 8. Okay? The other attachment site is taking the arm, I'm going to rotate it inward, place behind her back, bend the elbow. Okay, then we're going to see it wings out a little bit here. And the other is the vertebral border of the scapula. Okay, so it's going to be here. So we'll start out with doing some glides. So now I'll need a little lotion. I told you I might need some. I told you that.
Am I supposed to be on the motion?
Oh, yes. What did you do? You're fired. She's so fired. Okay. Now, is this a comfortable position with your arm up over here? Okay. Everything's going to work superior to posterior. Okay, so we're going up and back. Okay, so I'm going to start on the ribs. I'm just going to crunch this up. I'm going to work in front of it. Then when I want to work here, I can work below it. Okay, so we're having hot flashes. Do we need to bring that fan and point it on us over here, maybe? So we're not all dying. Are you going to be all right with that? I don't have a key.
No, I'm okay if it's on the back.
Okay, so the bottom rib you know is your 10th, right? Then you have 11th, 12th are your floating ribs. Here's her one floating, that's 11. Here's 10. So right there's the tip of her 11th floating rib. I can feel it here. So then the next rib comes up and under to the sternum. That's your 10th. So when I find 10, there's 9, there's 8. Okay? So I'm starting on rib 8. I'm going to start just in front, anterior, working my way superior with the fibers. Now, if I go this way and go past the scapula, I've completely bypassed this. So what I want to make sure my focus is I want to make sure I'm aiming for the most inferior border here. Because 8's going to come to there, 7, 6, 5, 4, 3, 2, and then 1. And they'll all consecutively attach on that vertebral border. Make sense? Because they're not going to crisscross, right? Okay, so here's rib 8. Pressure's always towards the rib. I'm gliding towards the inferior angle, trying to go up under the scapula. Okay? So, I'm just going to take my glide, fingertip glide. I'm going to anchor a little bit. And here's the inferior angle.
Parallel to the ribs?
Yeah, kind of. Yeah, pretty much. Parallel, trying to go underneath the scapula. So I'm just going to take it to the edge. I'm going to do that on 8, 7, and 6 is angled at this direction, coming up under the scapula. Then when I'm coming up to about 6 from here, I'm going to take my glide and I'm going to go, wow, is that tender? It's tender. I'm adding more lotion. Too much pull. Too much pull and glide. So I'm going to
You
add.
didn't seem to care about that last Tuesday night.
Well,
That hurt.
you gave.
Oh.
Okay, so I'm going to go ahead and do 6 and 5 and 4. Now I'm going to hold here. I'm going to try to stay on the ribs. This is my brace point. 4 and 3. There's the ribs. Just doing a little glide here.
Well, those fibers are quite a bit shorter.
Yeah, shorter. These are real long from here to here. Then they go like this, here, here, and they get shorter, shorter, shorter. But they sort of angle like a
Fan.
half moon or a crescent or a fan. Exactly. So I'm going to go here. She's already having psychosomatic problems, and he already knows. But I did side myofascial with you. I didn't
Right,
do
it'll just
NMT on
tickle.
those.
Yeah.
Oh, that wasn't this. Oh, great, and that hurt even more.
Oops. I meant well. My heart was big in it. Okay, then I'm going to come here. Want to avoid the axillary region because you don't want to press onto the brachial plexus. So keep all your focus to the ribs. Come under. Stay on the ribs. So you're only going to do small glides as far as you can go. Stay on the ribs. Pressure towards the ribs. Now here, I'm about 3 and 2. Going to stay straight towards the ribs. Aiming for my finger towards the middle of the scapula around here, almost to the tippy top. Because remember, they consecutively attach on that whole vertebral border. Then I'm going to come just below you'll feel the edge of the scapula here. If you find the scapula, if you drop off of it, see how I just went, boop, it'll drop me down to the rib. And it'll avoid getting into the axillary region. Down towards the ribs, just small static pressure. I can't do much of a glide here. It's a little hard. Edge of this scapula here and the teres, drop down, boop, and I hit the rib. And then I'm going to do here. So while I'm up under here on 1 and 2, I'm going to friction the attachments on the ribs. Okay, so I'm just doing some medial lateral, cranial caudal. This is cranial caudal, this is medial lateral. I'm going to work my way down, pressure towards the ribs, sink down towards the ribs, friction the attachment. Cranial caudal and medial lateral. Working my way down. Underneath the scapula, bracing the back of the scapula, cranial caudal, medial lateral.
How's that, Janita?
Breathe in, babe. There you go. And exhale.
Actually, I will let you know, breathing does help ease the pain.
It does. If
It
you
does.
stop breathing, the second you stop breathing,
I know when I
it's...
breathed, I took deep breaths in, it actually lessened the pain more.
'cause
Just
you're-
a FYI. I noticed that.
And now that's a great testimonial because it is true. All my clients already know. I don't have to say it anymore. All they have to hear me is go, breathe. And then I figure as massage students, it does work, right? Cranial caudal, medial lateral, coming back under, frictioning the attachments. Now I can reach a little more of it here so I can come a little further out to treat and friction. And come to here. Remember, it's coming out in this shape, so I'm going to carry it out to here. Here's the edge of the serratus. Here's the tip, so I want to aim in this direction. If I go here, I'm missing it. I'm getting lat. Here's the tip of her scapula here, so I'm going to go before my finger. See, I'm coming in front of my finger, so that's the new angle. Then I come here to rib 8, 7, and 6, and I'm going to friction the attachments, friction medial lateral, working my way up to. This is my inferior hand.
How is your back? I mean, throughout that, you're okay?
You can also switch hands if you want to, if it's uncomfortable twisting.
Can you just repeat that again? So after you finish here with the last rib, then you go back down to 8?
Yeah, I go, well, I'll do all the glides to sort of warm up the tissue. Then while I'm up under 1, instead of going out and coming back under, I start frictioning down on the ribs.
Okay.
So I'm doing glides first on the bellies, and then I'm frictioning the ribs 1, 2, 3, 4, 5, 6, 7, and 8. Okay, so now I'm on 8. Now I'm coming around here. I'm going to find the edge of serratus. Here's the edge. Remember, it's on the intercostal spaces and the ribs themselves. Okay, so don't try to just get on the ribs. Get the spaces in between. See how my fingertips are aiming?
Okay.
Here's the vertebral border. if I drew a straight line, it would go continue under the rib and end up boink right there. Okay, so it would continue.
Is that muscle kind of tight to you?
Yeah, very,
Okay.
very. It's thickened, shortened. It's coming, but it's releasing. Can you feel like that? It'll just like soften. Yeah, the more you breathe. There you go. Now I'm just going to go back and hit a few more spots. This is the edge of her scapula where my thumb is, and I'm right on the ribs, pressure down towards the ribs here. Friction, trying to get under the scapula. Okay? So once you friction all of that, glides, friction, costal attachments. Then this is where you take the arm behind the back. So you're going to rotate it in. If they have a hard time rotating their arm behind their back, drape their arm forward. Follow the humerus up to the side of the scapula here, and there's a little bridge that comes like this of muscle. Anybody know what muscle that is?
Teres minor?
So you just put a little pressure on teres minor. It'll release a little bit. It'll allow the arm to rotate this way more. And then from that position, you can take the arm back behind the back a little bit easier. Now, all you're going to do here is you want to friction the attachments of the serratus. Now, in the book, I do believe they have her, she is, yeah, from behind. So just to make sure that I keep in sync with the book. So you want to look for the edge of her vertebral border of her scapula. And I'm just going to come and I'm going to friction the medial. Remember, you want to kind of go past the rhomboid. You have rhomboid first, and then underneath that's going to be serratus. So get your fingers to the edge and then try to hook underneath it a little bit. So remember, you're going to go a little bit deeper than rhomboids or further more towards the ribs. And come up the whole edge. Then you can do a little glide if you like. You can come over in this direction. Some people come.
So it's multi-directional friction.
I would do multi-directional, and then you can just kind of work the rib edge. Where the rib and the scapula meet, right there. So push thumb together, boom, boom, boom. You can come in this position. If this doesn't work for you real good, some people like this because they can get under, press, and then they can lift with their thumbs and do a little bit of frictioning here. It's more effective. I like it this way. And then you can also work that during rhomboids too. So if you want to have, if you have the person face down, you can also take it and do glides around that edge, knowing you're hitting serratus, and then come and work the bellies from here. Now I'm just reworking the belly here. Since I'm sitting behind it, I'm still pressing towards the ribs, I'm still frictioning. So I'm back behind it, I know here's my border, and I'm bringing my fingers towards my thumb. So this is just a little added technique that I like to do. So if you want to try that, it works just as good. Okay?
You're avoiding the accident.
Because you're coming here and you're pulling. Swallowed my gum.
Oh no, did you? Oh my goodness.
God, I was trying to talk and put it over there. And then I went,
I heard that. I heard it too.
I was like, oh,
No.
it's going to stick in my ribs for 25 years now.
No, we'll work it out.
Press on it, press on it.
Yes.
Yes.